Hi, my name is Kale Evans. I'm a student nurse here at Wilson State College, and today this is my skills video for inserting and removing a NG tube. So the first thing I'm going to do is I'm going to check my provider order for my patient here. So my patient today is Shirley Coast, 54-year-old female, the date of birth of 5/14/1964. She's in room 211-1. Dr. Leo is her doctor, and he has given the order for to insert an NGT tube for gastric decompression and then get an x-ray after. The diagnosis is swallow bowel obstruction, and so I'm seeing that she was admitted to med-surg on the 14th. Okay, so once I got all that checked, then I can go on to reviewing my the things that I'm going to be needing to do the NG tube insertion. So the first thing I'm going to need is a towel. I'm going to be needing my the tube itself. So this is a 14 French by 48 inch long. I'm also going to have a cup of water with ice that I'll put in with a straw for the patient to reduce if they start gagging, then that can help with the tube going down as they swallow. I'll have the 60 ml syringe so I can drop stomach fluids, and with those I'll be needing the pH measuring device with the pH strip and this cup, and that's where I will put the stomach fluids. I need to make sure that it's going to be between 1 and 4 on the pH scale. I'll also bring the lube in to lube on the tube, and then I'll have this nasal strip to help hold the tube into place. And then I'll be bringing in a pen light and tongue depressor for if the patient starts gagging. I can use these to see if the tube is curled up and into the back of the throat. I'm going to be bringing in a bunch of some alcohol swabs and adhesive remover, and some tape and a safety pin to make sure that the tube is on the patient's gown. I'll bring a Sharpie so I can mark the tube, and then I'll bring in a mesis bin, and then I'll be bringing in some Kleenex as well to have so that the patient can have it in case their eyes start watering or if they feel like they're gonna vomit or something, that they can have that for their help. So I'll just pack up all my things and get ready to head into the patient's room. And I'll make sure to fill that with water. And then I would perform hand hygiene when in the room, in the med room, and then as I leave into the patient's room, I would knock on the door, introduce myself as the nurse. So, how you doing? I'm Kale. I'm going to be your nurse today. I would close the door for privacy. I would perform hand hygiene, and then I would go over the procedure that we're going to be doing today with the patient, as well as confirming the patient in the room is the patient that's on my provider orders. So the first thing I'm going to do is, hey, how you doing? My name's Kale. I'm going to be your nurse today. We're going to be doing I'm going to insert an NG tube for you today, but first I need you to confirm your name and date of birth for me. So Shirley Coast, 54 female, and that's what's on the name tag here, or on the wristband here, Shirley Coast, 54 female, with the date of birth of 5/14/1964. So that matches. So then I can go on and explain what we're going to be doing today to the patient. So we're going to be doing a NG tube that's going to go into your nose and then down into your stomach to help with any discomfort you have in there. So could you tell me if you're having any pain today? On a scale of 1 to 10, 1 being not so bad and 10 being the worst pain you've ever had in your life? It's about a 7, okay, so, alright, so I'll take that into account. And then, is it a dull pain? Is it a sharp pain? Could you explain it to me? So it's a dull pain, okay. So with this NG tube, it's gonna help relieve that. So we're just gonna have you sit up into the high Fowlers, and then I'll just start unpacking my supplies. So I'm gonna remove the pillow from behind your head, all right, Shirley? Okay, so then you can lean your head back. I'm gonna get this towel across your chest, okay? And then I'm just gonna put on some gloves. I'll just lay all my supplies here. So here, Shirley, here's a Kleenex for you in case your eyes start to water. You can use that. And then, let's see here. So I'll just get this stuff all laid out and prepared. Okay, and then here's the bag. And then I got a cup of water here with ice in it for you too to help with the tube going down. You're just gonna be taking some sips on that, all right? So, before I go ahead and insert the tube, I'm gonna auscultate your bowel sounds, all right? I'm just gonna listen to your stomach. Okay, Shirley, so we got some hypoactive vowel sounds. So we're gonna go on with inserting this tube for you, alright? So, just gonna, before I do grab the tube, I'm gonna wipe down the patient's nose, just to get any grease, so when I go and put my thing that's gonna, the anchor for the tube, it's gonna stick well, and I'm just gonna disinfect the inside of the nose, and then I'll have the patient, I'll close each nostril and have the patient blow to see which nair is more open. So I'll just have you, all right, go ahead and blow, blow. Okay, so we're gonna do it in the patient's right nostril because that one sounds more open. Okay, so now that the patient is clean, nose is clean, we can go on with inserting. So I'm gonna open NG tube, get it out, and then I'm gonna measure, make sure it's closed, and I'll measure it for the patient here. So I'm gonna measure it from the tip of the nose to the earlobe, and then from there we're gonna go down to the xiphoid process. So that's right, make sure it's nice and tight. It's right here. Okay, and we'll just mark that with a Sharpie here. Okay. So now we got that marked. So then now that that's ready, we can go on with inserting the tube. So I would use the lube, I would insert it to about 4 and cover the first 4 inches, but since we're using these mannequins, we're having to use some certain spray lube on them, so we can't use these, but I would use this on in a real clinical situation for about 4 inches up. And then I would tell my patient that it's going to be uncomfortable, that we're just going to go on the, we're going to do the procedure, but before we go through, I'm going to have her confirm with me that she understands some hand signals before we go. So, so Shirley, I just need you to, when we're going with this, if you're feeling good and it's not too bad of a feeling, if there's not too much discomfort, I just want to have you give me a thumbs up. And then if it's too bad, you feel like you're gonna vomit, or if you feel like you can't breathe, then just give me a like a stop sign with your hand, all right? Do you understand these? Okay, perfect. So, now that I got this locked, and then we can go on and start inserting. So I'll have the patient's head tilted back, and then we're just gonna go and insert. Okay, and then the patient's gonna start gagging, so I'm gonna bring it back about 1/8 of an inch, and then I'll have the patient take some sips of water, and then every time that the patient takes a drink, then I'm gonna advance the tube a little bit more. So every time they swallow, I'll have them, I'll advance it. So once I get it past that, I'll make sure that it's not binding up in the back of the throat, and then I'll lean their head forward, and then every time they swallow, I'll go forward. So go ahead and swallow, 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 swallow. Okay, so we're at our mark here, and then I'm just gonna have them sit back, and I'm gonna grab my NG strip here. So now that we got that secured, I can go ahead and mark it where it is around the patient's nose. Okay. And then I'll go ahead and secure it to the patient's gown as well. Close off and toss them in the garbage. We'll get rid of this. And then we'll close pin it to the patient's gown. Okay. So now that that's secured, we got it secured to the patient's nose. Then go on and put on my gloves. Now I'm gonna aspirate this tube and draw out some stomach fluids and measure the pH of it. So I'm gonna pull back and aspirate 10 mils. Straight down. Then I'll pull it out. 10. And I'll cap it again. And then I'll bring it over here to my cup. And I would dispose of that, dispose or clean of it per facility policy. I'd mix this into the pH strip into that fluid, and then I'd match it here to my pH paper, and it's looking like it's about a 3. So with pH between 1 and 4, that's known as normal. So then I'd chart that down and write that down as normal, and then I would discard this per facility policy as well. And then I could clean up my workstation in the patient's room. I'd make sure that they don't need anything else from me. I can clean up their right here. Do this in the garbage. And then I would just make sure that the patient's sitting fine. They don't need anything from me. I'd make sure that they're sitting in the high fowlers, and then I'd make sure that they would get sent to x-ray to make sure that the tube is in the correct spot before any feeding is done or any medications is put through the tube. And then I could replace the pillow per the patient's request, and then I would leave the room and go and chart. So I'm gonna perform hand hygiene, leave the patient's room, and I would make sure that they're not set up to any suction because of course they need to go to x-ray. So then leaving the patient's room, I perform hand hygiene, and then now that it's a new day, I have a new order here for a patient to remove that NG tube. So I'm in my med room. I'm going to perform hand hygiene. I'm going to review it. So I'm going to make sure I have the same patient here. I got Shirley Close, 54, female, room 211, 1 with Dr. Leo, date of birth 5/14/64, and it's just telling me that pain's been resolved and we're going to be removing that NG tube. So for that NG tube removal, I'm going to be needing a towel, or 2 towels, one to help remove and discard, and then 1 to clean for the patient. And then I'll need some gauze, and I do believe that's about it. And then I'll need a pair of gloves and these Kleenexes. Okay, and so since I got that checked, I can then go on to meet my patient. So I can knock, enter, introduce myself again. Hi, I'm Kale, I'm gonna be your nurse today. I've got an order to remove that NG tube for you, so I just need to make sure that you can confirm your name and date of birth for me. Shirley Coast, 54, female, and that's what it says on the wristband, so a date of birth of 5/14/64, and that matches my MARA. Okay, so I'm just gonna take a listen to your stomach, all right, Shirley? Your bowel sounds are active, so that's good. How bad's your pain today? On a scale of 0 to 10? A 1, almost non-existent. Oh, okay, perfect. So that's good. That means that that tube's worked its wonders for you. So then we can go on to removing it. So I'll perform hand hygiene. I'll make sure that the tube hasn't moved any, and then I can go on to just removing it from the patient's gown. So I'll get rid of that and put the pin over here, and then I can put on my gloves. And then I'll talk to the patient, tell them what's going on with it. So it's not going to be comfortable. Again, I'll have you hold your breath when we're gonna pull it out. So you're gonna take a deep breath, and then you're gonna hold it for me, and then I'm just gonna pull the tube out for you, okay? So this is just an alcohol pad and adhesive remover. I'm just gonna get anything like that off. Any of that sticky stuff off your nose, okay? So I'll just wrap that around that then. And then I'd make sure that the patient's not hooked up to suction, that we're ready to go when we're ready to pull it. And I just make sure that the patient is covered well. So I'd make sure the patient's covered. I'd give them a Kleenex in case that they feel the need to wipe any tears that may come or anything. And then I'm just gonna grab my 4x4 gauze, and after explaining what the procedure is gonna be like, I'm gonna make sure I got a firm grasp. I'll have the patient in high fowlers, and then I'll have them take a deep breath and hold that deep breath, and once they're holding that deep breath, then I can pull. So go ahead and breathe in, Shirley. Take a deep breath, hold it. All right, you're holding it, and we're just gonna pull straight out. Okay, and then we're just gonna wrap it up in that towel. and discard that into the biohazard bin or per facility policy. And then we're just gonna wipe the patient down with an extra towel if anything got on them. And if they want, they can use an alcohol pad too. Okay, and then I'll discard of any of these things into the garbage. And then I'll ask them if they need anything from me, if they need to be sat down, laid down. If they want the pillow back behind their head, I'll help them with that. And then I can go out and chart the things the procedure that I just done, how the patient recorded to me that they were feeling, and with that, that will not end my skills video because I need to also write down my input and output sheet for today's date for Shirley. Okay, and then after that I'll make sure to chart everything, make sure to write anything down that the patient said and told me, and then that will be the end of this week's skill video.